Welcome to the Nursing Post podcast, all nursing, all the time, with Ashley Moore and Rosa Horsley. In this episode, we discuss immune thrombocytopenia Purpura awareness during its September Awareness Month. Our goal is always to inform, help, and start conversation.
ITP is a disorder that can lead to easy or excessive bruising and bleeding. The bleeding results from unusually low levels of platelets, and that's what helps blood clot. Patients who have ITP often have purple bruises called purpura. These bruises appear on the skin or on mucous membranes. Patients who have ITP can have bleeding that causes tiny red or purple dots on the skin that look rash-like, and those pinpoint-sized dots are called petechiae. There are two forms of ITP. There is acute thrombocytopenic purpura. This usually affects young children aged 2 to 6. The symptoms can flare after a viral illness like the chickenpox. Acute ITP usually starts suddenly, and symptoms usually disappear within less than 6 months and often within a few weeks. So treatment is often not needed and symptoms do not reoccur, and acute ITP is the most common form of this disorder. So that's a good thing.
Well, acute, it's something that, flares and then goes away.
Right. And then there's chronic thrombocytopenic purpura. This onset can happen at any age, and the symptoms can last a minimum of 6 months, but it can actually stay around for a lifetime. Adults have this form more often than children do, but it also affects adolescents. Females are 2 to 3 times more likely to have this than males, and chronic ITP can reoccur often and requires continual follow-up and care, and it needs to really be by a hematologist.
Well, that's their specialty.
Exactly.
And as we know in nursing, chronic is not, short. It's long duration.
Right.
So you do want to make sure you're being followed up with by a hematologist.
Right.
So my favorite part is statistics.
Yes.
Give me some numbers. ITP among adults in the United States is estimated to be 3.3 per 100,000 adults per year. Annually, it is estimated that there are 5.3 per 100,000 among children because children with ITP usually recover, and the number of children who have ITP at any one time is almost equal to those diagnosed annually. About 40% of all patients diagnosed with either form of ITP are children younger than 10 years old. Among children, the incidence is greatest between the ages of 2 and 4. The incidence of ITP in adults is approximately 66 cases per 1 million per year. An average estimate of the incidence in children is 50 cases per 1 million per year. New cases of chronic refractory ITP comprise approximately 10 cases per 100 million per year. The mortality rate from hemorrhage is approximately 1% in children and 5% in adults. Spontaneous remission occurs in more than 80% of cases in children.
Some signs and symptoms that you would want to look out for with ITP. Easy bruising, bleeding of the gums, nosebleeds, internal bleeding, heavy menstrual periods, blood and vomit, urine or stool, and bleeding in your brain, which is the most dangerous part of ITP. So a head injury that occurs and then there's not enough platelets to stop the bleeding can be life-threatening.
Absolutely. The causes and risk factors for children, that viral infection.
Right.
It could be chickenpox, but it could also be hepatitis. It could be AIDS and can prompt antibodies that cross-react with your platelets. Pregnancy is a risk factor. Immune disorders like rheumatoid arthritis and lupus are risk factors. Low-grade lymphomas and leukemias may produce abnormal antibodies against platelet proteins. Being female, like we said earlier, women are 2 to 3 times more likely to develop ITP, and some ITP is idiopathic.
If a provider is trying to diagnose ITP, really you need lab work, a physical exam, and exclusion of all other possibilities of why there's a low platelet count. There are isolated thrombocytopenia that you can use a CBC to check. What they do is the white blood cell count and the hemoglobins are typically normal, where the platelet counts are low. Unless there's a severe hemorrhage, then of course that's going to make some changes there. And on a peripheral smear, there are truly giant platelets suggested of congenital thrombocytopenia. So that's actually something that you would just have to send off for. And rarely adults may need a bone marrow exam to rule out other problems such as like cancers or things. I mean, so it's kind of a disease of exclusion.
Yeah, it's a process of elimination, but science isn't exact. It's really never been. I think doctors call it the differential.
Right. And that's when I talk to patients, I'm like, that's why they call it the practice of medicine, because it's not an exact science yet. It's still, and we're still learning. And there are things that we do today that in 20 years we will laugh about. Just like 20 years ago, we're like, I can't believe we were doing that. That's ridiculous. So it's a constant evolution. Some treatments for ITP are really simple. It's nothing more than monitoring and labs, and that's all you're going to do. And that's great for people who have, ITP and it's not serious. But it can get serious. At present, most treatment protocols concentrate on the reduction of platelet destruction. And the drugs that they use are usually, immunosuppressive. You don't have enough platelet counts, so we want to make sure that we are helping stop the destruction of those platelets.
Makes sense to me.
So there are some medications you can take, and some are simple. Steroids.
Yeah, those are prescribed almost all the time.
Yep.
Yeah, it's very common.
So one of the main ones that is used is something called prednisone, which is a steroid. And what they do is they put you on that, get your platelet counts back to a safe level, and then you taper off of the medicine. It's never something that you want to stop abruptly if you've been on it for a prolonged period of time. But prednisone is not a benign medicine. And this is something that I think I preach every
single day.
Yeah. There are complications and there are risks to being on prednisone long term. Mainly risk of infection does cause elevated glucose levels, so high blood sugars, and osteoporosis. It is tough on your bones.
It is. I know we're pulmonary and we see a lot of patients that are prescribed steroids, and they'll tell you, oh, I feel great, I feel like a different person, I want some more. And you're like, well, you really don't want to be on that every day for the rest of your life, because there's consequences for being on that. So you just need to make sure those benefits outweigh those risks, as your doctors are probably prescribing it as that anyway.
Right. Another medication is immune globulin. So if the prednisone doesn't work, then you would do IVIG injections or infusions, and doesn't stay in your system long. So you need to have these infusions or injections usually bi-weekly.
Wow. And
if there's like a critical situation, you can do that. So what they're doing is infusing IVIG into you to help boost your body's platelet production. We do have some patients that are on different, IVIG therapies. So it's a wide range of things that these medicines can do. The thrombopoietin receptor agonist is medicines that boost platelet production. If prednisone doesn't work and then the infusions don't work, and it's kind of the next step is these medicines to help boost the platelet productions, you may wonder why you wouldn't start with this. But again, there are risks and benefits.
All medicines. Yeah.
So because these medicines help boost platelet production, there are medicines like Nplate or Promacta, because they're actually having your body build more platelets, which is what helps your body clot. Well, now you're at risk for blood clots.
Yeah, throwing clots, DVTs, pulmonary embolisms, like
strokes are from clots. There can be heart attacks from clots. So again, not a benign drug. And another medication is chemotherapy. Believe it or not, there is Rituxan or Trumixa, which helps increase your platelet count by reducing your body's immune response that's actually causing the damage to your platelets. Those drugs can also reduce the effectiveness of vaccinations. So again, you have to weigh benefits and risks. So none of these medicines are to be just stick me on that and taken lightly.
Absolutely. You shouldn't be flippant about it. You should really consider the pros and cons and have a serious conversation, with your provider, your physician. I think one of the most important things, if you have any illness or diagnosis, is the fact that you feel comfortable enough to speak to your physician and that you feel like they're going to be straight with you. So tell me, doc, what's the best part of this, and tell me what the worst part of it is.
Right.
And then make informed decisions based on that.
Well, and that's, in my opinion, what healthcare providers are supposed to do. You're supposed to educate the patient so that way they can make the best decision about their health care.
Absolutely.
Not make it for them.
So another treatment is surgery, splenectomy. This quickly eliminates the main source of platelet destruction in your body and improves your platelet count. Though, once again, it's like that risk versus benefit thing. Living without a spleen permanently increases your susceptibility to infection. And in emergency treatment, severe bleeding can occur with ITP, but this is rare. Treatment typically includes transfusion of platelet concentrations, steroids, and or IVIG. So outweigh your benefits and, your risk.
Right. And so one of the big things that I kind of think of is nursing considerations. What do we need to know as nurses for patients who have ITP? What do we need to do differently? And these honestly are, in my mind, what I would consider basic. Focus on ABCs, which include providing oxygen if needed, controlling severe hemorrhage, and initiating IV fluids to maintain hemodynamic stability. And of course, if a patient has a large intracranial hemorrhage, you may have to support their airway. Which
ABC.
Yes. Addressing risk factors for bleeding, such as GI disease, central nervous disease, urologic diseases, different lifestyles. All those things go into it. So if you have a person who has a desk job for a living versus somebody who works cutting down trees for a living, risk factors are changing there. If somebody, if you cut yourself with a knife versus if you get cut with like a chainsaw, the outcome can be
different,
completely different for patients who have ITP, which obviously for anybody, but if you can't clot,
that's a big deal.
Then that's a problem. And then educating patients to be diligent to prevent bleeding, prevent injury so they don't cause bleeding or internal bleeding, and help with infections, because most of the medications that patients are on for ITP, you have to worry about superimposed infections.
So when I was reading this and we were doing our research, I thought, okay, if I was a patient that was like newly diagnosed, or somebody in my family was newly diagnosed with ITP, what would I want other people to know so that they could better, advocate for themselves?
Right.
So you definitely want to do your homework and you want to research. And I'm sure your provider, if you're newly diagnosed, or your physician, is going to provide you with information.
Sure.
Okay.
I would hope.
Yeah, I would hope so too. You want to write down, your questions that you want to ask the next time you visit. any questions that you have about medications, appointments, treatments, testing, anything that's new. You want to just keep a log or, a book of those things written in it. When you go to appointments, if it's possible, you want to bring somebody with you to those appointments just to have a second set of ears on the situation, and to ask questions. And I know right now, sometimes that's hard to do because of the environment that we're living in. But, cell phones have come a long way, and you can always still bring in an extra set of ears with a phone call.
If you're getting information, and it's a lot of information, it's new information, as a patient, you may not think about the questions that somebody else will be like, well, what about this? And they're, well, I didn't even think about that. Well, they were too busy getting a diagnosis.
Well, yeah. And sometimes when you are getting a diagnosis, seriously, sometimes you just blank.
Yeah.
Sometimes you're in shock and you're just trying to process the last thing they said, not the 8 sentences that came after the diagnosis.
Absolutely.
So I think it's always important to have somebody with you. You want to write down names of any new medications, treatments, tests, or any new instructions. You want to write down appointments, the dates, the times, and the purpose for that visit. You want to be comfortable enough to have truly open conversation with your physician and provider. You have to be able to feel comfortable enough to advocate for yourself. So if you're with a physician in which you're asking questions and you're not really getting any answers, or it's not being explained to you in a way in which you can understand, then, it's okay to ask for a second opinion. It's right. Actually, if you have a great doctor, they're not going to discourage it.
I am a very big advocate for, if you don't have a good relationship with your doctor, then that's worse for your health, because you have to be able to trust them to tell them what's going on and let them sort through the issues that you're having and help you. And if you don't trust your doctor, if you don't like your doctor and you're going to them, you're not going to be open and honest with them, and things are going to get missed.
Absolutely. I agree with that. And the other piece of advice that I would give is support groups, support organizations. Platelet Disorder Support Association, pdsa.org, has a lot of information about ITP. And I was scrolling through there last night, actually, and I was surprised about how much information is offered on there, and that they have local chapters for your state. And so that's a good outlet. You should always try to look for those support groups.
Right. Especially if you have, I couldn't imagine having children that want to play certain sports, but maybe contact sports are not the best if your child is suffering from ITP.
Yeah. Might have to go another route.
Right. Although there are about 50 children and 66 adult cases per 1 million of ITP diagnosed each year, we still find it important to bring awareness to this illness. As nurses, we need to continually educate ourselves and be able to provide appropriate patient care, education, and advocacy, because that's what we're supposed to do.
That's our job as nurses. As always, we will link our references on our website, www.thenursingpostpodcast.com. We would love for you to join the conversation and leave your comments and your suggestions there too. Be sure to subscribe to our podcast, listen to us on your favorite platform, and follow us on Instagram and Facebook. Thanks again for listening to The Nursing Post.